Andrew Stettner, now he is the Senior Fellow at the Century Foundation. Real focus on all research to do with unemployment, to do with modernising workforce protections in particular. Of course, full disclosure, it is a progressive public policy firm, so it is of that mindset. Andrew, talk to us about what we are seeing at the moment. September the 6th, upon us, suddenly the enhanced federal unemployment benefits were being pulled back, already scaled back to a large extent in some 26 states, but then pulled away from the others. Tell us how many people you estimate this has affected.
You know, this is a turning point in America's response to the COVID-19 pandemic. Up until now, we've had this idea that if our neighbors lost their jobs because of these unique circumstances, we're going to make sure that they weren't harmed over the long term. And we do that by sustaining their income, protecting their housing. Now, as we've come upon Labor Day, you know, that safety net has been taken away. People are on their own, and if they don't find a job quickly, you know, they're going to be suffering the same kind of economic downward mobility that we've seen over and over again in our economic crisis in America. You know, I originally estimated 7.5 million people would be impacted, you know, by this cutoff. And, you know, as of the most recent data, it's even more. It's definitely going to be well over 8 million workers who are cut off from benefits, receiving those, of course, and their family are receiving those will be cut off as of Labor Day of this year.
Of course, Andrew, the anxiety has been heightened by the fact that we got the non-farm payrolls on Friday that painted a far worse picture than many were anticipating. Some of the frictions within the labour market clearly evident, some of the concerns around the Delta variant as well. And also just what's so painful to see is this ongoing inequality that we see in terms of returning to the workforce. Black unemployment ticking higher, for example, in the previous month. Who is going to be left behind the most at the moment with the pullback in the federal benefits?
You know, that was the problem here. You know, this decision was made you know, to let these benefits expire at a time when we thought by Labor Day, things would be back to normal. We'd have achieved herd immunity. The job market would return in all sectors, and that hasn't occurred. You know, there was this pullback in hiring, certainly many job openings listed, but restaurants, arts and entertainment, other service sectors, you know, have been forced to pull back because of the Delta surge. And, you know, this is going to really impact a different kind of worker than we've seen in the past. You know, American recessions in previous times, you know, they hit manufacturing, construction, you know, your prototypical white working class male losing their jobs. Now we are seeing the service sector, you know, be the one impacted. You know, it is more focused on women, more focused on people of color, especially when we think about the problems with childcare and also the fact that this Delta surge is hitting parts of the country, you know, that have a much higher share of Black workers, you know, coming from a community that's been devastated by COVID and has very rightful concerns about whether they'll be protected, even if vaccinated, if they go back to work in many of the sectors today.
Of course, we still stand and watch the ongoing debate going on between Republicans and Democrats about the future of spending, federal support, $3.5 trillion still being promised in some way to tackle some of the issues you discussed, the childcare crisis, the caregivers crisis in particular. There's meant to be some support coming for that if indeed some of that money does indeed get through Congress and get passed. What do you think has changed through what has been a grand experiment? I come from the UK where the social safety net is a lot more evident. We have a free healthcare system. We do have more benefits, for example. In the United States, there's always been sort of a different perception of that. Has that changed at all? Do you think going forward there will be more of a social safety net in reality?
You know, I think what the COVID-19 pandemic has offered America is a lesson that we don't have to submit to a crisis and allow that to push families deeper into poverty. You know, we can sustain people through this crisis. We can be effective in getting people resources. We can tackle child poverty. But the question that we have is whether that will be temporary or whether we commit to having a society that protects people that doesn't continue to exacerbate inequality. And we have some work to do. During the pandemic, the economic gains filtered to the best off in our society. And we have to say, well, we need to structure things so everyone can share in prosperity. So I think there has been a lesson learned in how effective it can be to support people. And now we have to decide, as a country, whether we put something a little more permanent in place, the building blocks that, as you say, are pretty standard across the industrialized world. If you have a child or a sick family member, you get some paid leave. If you need to work as a parent, there's affordable childcare available. These are kind of, I would say, the basics of a functioning society, the infrastructure, that we need. But we have not had them in America, and we have a chance over the next really 2 or 3 weeks to put really those building blocks into place.
Andrew, as a man who's been focused on modernizing workforce protections, in particular the social insurance programs, what's one key wish you want to see?
Well, I think, as we see, this lesson, in terms of unemployment, the delays and challenges, Congress had to throw, the kitchen sink at this problem to solve it because the system was broken. I'm really hoping that we'll take some first steps to fix the safety net, for the unemployed, so it is there always. And, the benefits can be extended and enhanced when there's a crisis like COVID-19, and that happens automatically. So we're looking for some fixes to the unemployment program. And I do hope that Congress will be looking at this Delta surge and to see what kind of lasting impact has. What happens to all these 7.5 to 8 million people who get cut off of benefits on Labor Day? What happens to them? Do they go back to work? Or is there going to be some assistance additionally needed to help people navigate a very challenging environment?
Andrew Stettner, Senior Fellow at the Century Foundation, thank you so much for your time today. Stay well.